Now, I'm over to our last pre-doc researcher for this morning, and that happens to be Rachel Black. And Rachel is a student in Ulster. Rachel has a psychology background, and Rachel has a BSc and a master's, and she's also on a funded PhD. And some interesting things to say to you about Rachel. She's a co-chair of Birthwise, a new maternity charity formed in Northern Ireland, and she's also a trained breastfeeding peer supporter. And she's a mother of two lovely young boys, and I normally see them in the background, but I don't know where they're at today. But and Rachel's been breastfeeding for 5 years, and we're delighted to have you, Rachel. Over to you.
Thank you very much, Marlene. I am just going to share my screen. Let me see. Is that up for everyone there? Is that okay? Mm-hmm. Great, perfect. So thanks very much, Marlene. I'm delighted to be here today. It's so lovely just to be joining everybody here and discussing one of my big passions, and that's breastfeeding. My name is Rachel Black, and as Marlene said, I'm a PhD researcher. Marlene is one of my fabulous supervisors, so I'm very, very lucky. And today I'm going to talk to you about breastfeeding, perinatal mental health, and just have a chat about what we can do and how they're linked. So just a little background. Up to 20% of women will suffer from mental health disorder during pregnancy or in the first year after birth. And this, her previous sort of mental health history, experiences during pregnancy, the type of birth that she's had, subsequent breastfeeding experiences can all be factors which increase the risk. And of course, these figures were pre-COVID, so the likelihood is that we are going to see an increase in these rates. Now, the cost of perinatal mental health in the UK has been estimated at around 8.1 billion per each 1 year cohort of births, which equates to around about £10,000 per birth. And this is because perinatal mental health, it not only affects the health of the mother, but it actually affects the health of the child over the life course. So it's really important to try and look at ways that we can reduce the risks that are associated with developing perinatal mental health issues. So with risk reduction in mind, it's worth looking at this relationship between breastfeeding and mental health. There's been numerous research studies over the last few decades that have shown that breastfeeding has protective factors for maternal mental health, but it's a really complex relationship, and individual factors often play a part in perinatal mental health and also in breastfeeding outcomes. It's been found to be a bidirectional relationship. Research has found that prenatal anxiety and depression is linked with poor breastfeeding outcomes, and then conversely, poor breastfeeding experiences can actually increase the risk of a woman getting postnatal depression and anxiety. So this really does highlight why we need to look at the research to see why breastfeeding is linked, and to try and understand what measures can be taken to support women to prevent mental health issues while also helping to facilitate good breastfeeding outcomes. So when women are struggling with their mental health, they might describe feeling exhausted, worried, tearful, irritable, or they may even describe having really negative and intrusive thoughts. And this can all affect how they interact with their infant. They may find it more difficult to be responsive to their baby, maybe difficulty reading their hunger cues, and in some cases, they might actually be less sensitive to their baby's positioning and attachment on the breast. So these are all things which can negatively impact on breastfeeding outcomes. So having considered how perinatal mental health can impact breastfeeding, now we can look at the impact of breastfeeding on mental health. And Professor here, so I hope I'm not boring everybody by telling you again, but breastfeeding has been shown to have a positive effect on mother and baby when breastfeeding is going well. And this is because when breastfeeding, there's a release of oxytocin, that lovely love hormone that helps relax mum and facilitates bonding, but also prolactin as well. And prolactin can actually help, it acts like a stress buffer, so it can protect mother's mental health through that sort of buffering of stress that she may be experiencing. However, for women who aren't having a great breastfeeding experience and they're having quite a negative one, and they maybe have pain or physical difficulties, latch problems, research has found them to be at a higher risk of developing postnatal depression. And also very important are women's goals and expectations of how they'll feed their baby, because that can impact on their mental health. And again, Professor Amy Brown's research into breastfeeding experiences found that women who had to give up before they were ready were describing feeling traumatized and filled with grief. And for some women, they described feeling like a failure, because for them it was such a fundamental part of their identity as a mother that for them this suggested that if they couldn't breastfeed, they weren't a good enough mother. It just had that real sense of motherhood for them. So considering what we've discussed so far, if a woman's breastfeeding experience has not gone well and she's been experiencing physical pain, struggles with latch, or struggling with the prospect of having to give up before she was ready, then the idea of breastfeeding trauma doesn't seem so far-fetched. And one definition of trauma states that individual trauma results from an event, a series of events, or set of circumstances that is experienced by an individual as physically, emotionally harmful, or life-threatening, and that has a lasting adverse effect on the individual's functioning and on their mental, physical, social, emotional, or spiritual well-being. Now, there are other factors linking breastfeeding and mental health. I mentioned earlier how a woman's previous mental health history can actually increase the risk of perinatal mental health disorders. Well, previous life events can actually impact on breastfeeding outcomes as well. For example, childhood trauma has actually been linked to earlier formula introduction. Mm-hmm. And also really important to consider is how a woman's birth experience can impact on her breastfeeding decisions, with some describing a fight or flight type response. For some women, breastfeeding is almost like an atonement for the birth. They felt like they failed at birth, but they want to fight to succeed at breastfeeding. But on the other hand, for some women after birth, traumatic birth, the potential of breastfeeding not working out can just seem too much to cope with, so they just decide against it. So how can we help? Well, the treatment we propose is AMDR. And for those of you who know about AMDR, it may not be immediately apparent that it's suitable, particularly in the context of breastfeeding. However, when we think about negative breastfeeding experiences as being a trauma, then we can begin to see how it might be utilised. Now, for those of you who are wondering what on earth I'm talking about, AMDR stands for eye movement desensitisation and reprocessing. It's a transdiagnostic psychotherapy, and it's based on the adaptive information processing model. And this model suggests that current symptoms and disorders are attributed to past unprocessed memories, which have become trapped in our brain and not linked properly with the existing memory networks. So it focuses on the cause rather than the diagnosis of, rather than that perinatal mental health diagnosis. So in the context of breastfeeding, a woman's emotions and memory of that breastfeeding experience can remain so vivid in her mind. Therefore, AMDR can aid in the reprocessing of the memory, so it no longer has that same emotional charge and can enable the woman to heal. So how does it work? During an AMDR session, you're asked to think about the distressing memory and at the same time move your eyes from side to side. It's often clinician guided. Or you can tap alternately on arms or on each leg. And these side-to-side movements and sensations have been found to help the brain unstick that memory that's stuck in the brain and allow that information to be processed properly like a normal memory, and to help stop it feeling so intense. Of course, now one of the challenges we face is how to bring EMDR to women during the COVID-19 pandemic. And my recent systematic review sought to determine the effectiveness of online psychotherapy for women with a diagnosis of a perinatal mental health disorder. The results were positive and found online psychotherapy interventions are effective in improving clinical outcomes. However, despite NICE recommendations for the use of EMDR during the perinatal period for the treatment of PTSD, there is still a gap in research into online EMDR interventions in this period. There's also a gap in the research for online psychotherapy interventions that are delivered via video conferencing platforms like Zoom, and also a lack of research into online psychotherapy for disorders other than perinatal depression and anxiety. So what does this mean for breastfeeding research? Well, 2020 has brought about so much change and uncertainty, which has only added to the lack of access to breastfeeding support and has increased anxiety. So my current study seeks to develop an online AMDR intervention for pregnant women who've had a previous negative breastfeeding experience that's still having a lasting impact on them. And we hope that we can provide women with access to a psychotherapy where they can be safe at home and supported through AMDR to help them process their negative memories and hopefully enable them to get to a place where they feel they can breastfeed again. So just in summary, the complexity of the relationship between breastfeeding and mental health requires an open mind and thinking outside of the box. And the AMDR therapy provides an alternative to conventional breastfeeding interventions. COVID-19 has highlighted the importance of access to support and mental health care for women at home. So online psychotherapy for perinatal mental health is effective and can provide safe treatment, but research into online EMDR is essential along with other modalities such as video conferencing platforms. Thank you all very much for listening, and I'm happy to take all the questions.
Oh, thank you very much, Rachel. Fabulous, thank you very much. For those of you who haven't heard anything about EMDR, it really does work. I can tell you myself, I've taken a woman who was severely traumatized with her birth experience, and I've seen it work. So it really is amazing. And Rachel's research will be mind-blowing, certainly in terms of this field. I mean, there's nobody else doing research like this at the moment, so we're delighted that she's doing it, and we're delighted to have a support from our US colleagues as well do the research, and our Professor Paul Miller, who is a psychiatrist and a visiting professor at the university. So it's really novel stuff, Rachel. And I don't actually have any questions lined up for you yet, but I'm sure that they will come and we will be able to pass them forward to you. But Rachel, thank you very much for a lovely presentation.
Thank you.
Thank you for sharing that with us.